Second white coat. Subscribe and like. Let's learn medicine together.
All right, today we're doing something a little different. We're going to put on our detective hats and solve a real high-stakes medical mystery. We're going to break down exactly how doctors use clues, evidence, and pure deduction to crack a case where a life is literally hanging in the balance.
So here's the big question we're tackling. How in the world do doctors solve a life-or-death puzzle that's happening inside the human brain? I mean, when the symptoms are all over the place and the clock is ticking, how do you find that one killer hiding inside the central nervous system? It's a process that, you'll see, looks a whole lot like a detective story. And we're going to follow every single clue right from the start.
Okay, so every good investigation has to start somewhere, right? It starts with the case file. This is where we meet our patient for the first time and get the initial details of the crime scene, which, in this case, is the human body itself.
So the case file opens like this. A 52-year-old man comes into the emergency department. Now, right off the bat, we've got two huge pieces of information. First, his age, 52. And second, a really significant risk factor. He's immunocompromised because of HIV. That fact alone immediately puts us on high alert for some very specific kinds of infection. And then there are the symptoms. Look, this isn't just, oh, I have a headache. This thing has been getting worse and worse for 3 straight weeks. You add fever, vomiting, and a stiff neck to that, and bam, you've got the classic signs that something is going terribly wrong with his central nervous system. His condition is deteriorating and fast. The pressure is definitely on.
All right, we've got the initial facts of the case. So what's next? Well, just like in any investigation, it's time to line up the usual suspects. In the medical world, this has a fancy name, a differential diagnosis. It's basically just a list of the most likely culprits that could be causing all these symptoms.
And here is our lineup. Based on everything we know about the patient so far, doctors would immediately be thinking about these 5 conditions. You've got a bacterial infection, a viral inflammation, a couple of different parasitic infections, and even a form of cancer. Any one of these could be our culprit, but only one is going to fit all the evidence we find.
So, how do you even begin to tell these suspects apart? Well, one of the first, most critical clues is the timeline. Remember, our patient's symptoms developed over 3 weeks. That's what we call a subacute onset. This simple fact makes something like HSV encephalitis, which is acute, it hits you within hours or days, a much less likely fit. The timeline is our first big filter to narrow down the suspects. Okay, so the investigation now heads to the forensics lab. And unfortunately, in this particular case, the definitive, undeniable evidence came from an autopsy. This is where we're going to find the hard, physical clues we need to finally solve this thing.
And this really just drives home that subacute timeline we were talking about. 3 full weeks from when the headache started to when he ended up in the hospital. This kind of slow burn is a signature, a calling card for certain kinds of pathogens. It's a piece of evidence we absolutely cannot ignore.
So here it is, the case file itself. Yep, the autopsy report looks dense, it's filled with all this medical jargon, but I promise you, hidden in all that text are the fingerprints of our killer. So let's break down exactly what the medical examiner found inside. Okay, let's dig into these clues. First up, a thick gelatinous exudate. Just think of it like a sticky, inflamed gunk at the base of the brain. Second, hydrocephalus. That just means there's a buildup of fluid, which is causing a ton of pressure. Third, infarcts. These are basically little areas of dead tissue, signs of a stroke. And finally, and this one is absolutely critical, there are no mass lesions. No tumors, no abscesses, nothing like that inside the brain tissue itself. Every single one of these findings is a huge clue. All right, let's recap. We have our patient profile, we have our lineup of suspects, and now we have our forensic evidence. It is time to put it all together, eliminate the ones that just don't fit, and reveal the one single diagnosis that explains everything. But you know what's really fascinating? When this exact case was presented to a group of medical professionals, they were all over the map. Look at this. Only about a third of them actually got it right. This just goes to show you how tricky these cases can be. It's definitely not always an open and shut deal. And the correct diagnosis, the one that top 33% landed on, is tuberculous meningitis, or, TB of the central nervous system. So that's the what, but now for the most important part, the why. Let's prove it.
So how does this all lock in the case for TB meningitis? Well, it fits every single piece of evidence like a key in a lock. That subacute onset of 3 weeks? Check. The patient's HIV status being a huge risk factor? Check.
Those very specific autopsy findings, the gunk at the base of the brain and the fluid buildup, check and check. And that crucial final clue, the absence of mass lesions. That helps us rule out other big suspects like lymphoma and toxoplasmosis because they almost always show up with masses. It is literally the only suspect that fits all the facts. Case closed.
Look, solving this one case is fascinating, for sure. But the real takeaway here, the real value, is understanding the process they used to get there. This whole diagnostic method is an incredibly powerful framework for thinking, and you can apply it to so much more than just medicine.
And this right here, this is the playbook. It lays out the framework perfectly. You start with the profile, right? Who are we dealing with? Then you establish the timeline. Is it fast or slow? You analyze the main symptoms and you look for the hard evidence. You line up your suspects, your potential explanations, and then you just systematically check them against the facts. And you keep ruling out what doesn't fit until only the truth is left standing. It's just a rigorous, logical, and honestly, super effective way to solve any complex problem.
And that really leaves us with one final thought. This whole methodical, evidence-based way of thinking, it isn't just for doctors. Think about it. Whether you're troubleshooting a problem at work, trying to figure out why your car won't start, or even just trying to sort fact from fiction online, this way of thinking is like a superpower. So the real question is, where are you going to use it next?